Welcome back to the Bigger Than Birth podcast, where we're celebrating bigger bodies and beautiful births. I'm your host, Victoria Gaba, and each week we will be bringing you the real stories of plus-size moms as they share their journey through fertility, pregnancy, birth, and postpartum. These stories highlight what it's like to navigate through this experience as a woman in a bigger body in hopes of creating representation for plus-size moms, both present and future. Thank you for being part of this community as we share these stories that are so much bigger than birth. Hi everyone, welcome to today's show. Today we are joined by MaRiahh, a mother of three who shares her powerful and unfiltered journey through infertility, sobriety, and fierce self-advocacy. After navigating a PCOS diagnosis and 2 years of infertility treatments to conceive her first son, MaRiahh's second pregnancy presented an entirely new set of complexities when she discovered she was expecting triplets. In this episode, MaRiahh opens up about the clinical and emotional realities of making the tough decision to undergo a selective fetal reduction to safely carry the twins. She also takes us inside the delivery room, detailing how she stood her ground against rigid hospital protocols to successfully deliver her Breech twins vaginally. From the roller coaster of fertility both times to her postpartum experience and her redemptive feeding journey the second time, MaRiahh's story is a picture-perfect example of bodily autonomy and taking control of your healthcare choices. I hope you enjoyed today's show, and here's MaRiahh. Hey, MaRiahh, thank you so much for coming on the podcast today.
Hi, thank you for having me. I'm so excited.
We are super excited as well. I know you have quite the story, but before we jump into that, why don't you tell us a little bit about yourself and your family and where y'all are from?
Sure. Okay, so my name is MaRiahh. I have a 2-year-old and 6.5-month-old twins. My husband and I have been together for 5 years, and I live in Cleveland, Ohio.
Well, then we will go ahead and get started with your first son. So were y'all planning to conceive when you did with him?
Yes. Well, we were planning to conceive years earlier, but I have infertility issues. So we went through a couple of years of fertility treatments, many failed cycles, and finally got pregnant in April of 2023 is when I got my positive test. And it was via Gonal-F, which is a follicle stimulating hormone. I tried Letrozole and Clomid. Letrozole did not work for me. It gave me lots of crazy menopausal type of side effects. But the combination of Letrozole and Gonal-F injections, and we did IUI. And I got pregnant my first round of IUI.
Were you seeing a specific fertility clinic or was that all through your OB?
I was seeing an endocrinologist through Metro Health. It wasn't a clinic. It was through like Metro Health.
Got it. But they were specializing in fertility and things like that.
Yeah.
I know fertility journey in general can be a stressful and emotional time. How long were you trying before you decided that we were going to go see an endocrinologist or someone to help look into fertility?
So I knew I had PCOS. So when we got to about that 6-month mark, and I still had not had a period, because I was on birth control and then I went off of birth control and I still didn't have a period. So around that 6-month mark, I was like, we need to see what's going on. So I asked for an ovarian ultrasound to check my ovaries and see what was going on there. And that is when it was once again confirmed that I had PCOS and that I would need some help probably because my ovaries were not doing what they were supposed to do. That ultrasound was done by my OBGYN, and I was referred then to the endocrinologist. So right around that 7-month mark is when I started medicated cycles. And we did medicated cycles for an entire year. So then we were at a year and 7 months, and I still hadn't gotten pregnant. And so then we needed to try IUI, but the timing kept being off. So I didn't actually get to do my first IUI until pretty close to exactly 2 years of trying. And then it worked on the first time.
So why don't you tell us a little bit about the IUI process that you went through?
Yeah, IUI and IVF, even though they sound similar, are like completely different things. So I'm so lucky that I never had to do IVF. I just essentially did all of the steps leading up to IVF. So stimulating hormone injections. And then IUI is just when you are artificially inseminated with sperm during a medicated cycle. Or I guess some people, I guess, can do IUI without doing a medicated cycle too. But yeah. It was difficult to get the timing right. Like I said, it was hard to get the timing right because if you ovulate on a weekend, you're kind of out of luck, which happened for like multiple months in a row, unfortunately. And the process itself was it felt a lot scarier leading up to it than it actually was. It was quite simple, a little bit uncomfortable, but I went into it telling myself if I'm preparing to give birth pretty soon here, I can definitely deal with a catheter into my cervix. It's just you just gotta do what you gotta do. But, um, definitely the IUI itself was nowhere near as hard as the actual years of infertility.
Yeah, exactly. When
Yeah,
you've gone down that road, you're kind of willing to try
anything.
what's available. So then obviously you're monitoring kind of when your IUI happened, the day you know you're ovulating. So you were kind of expecting or hoping for that positive pregnancy test.
Yeah,
So talk us through finding out you were pregnant for the first time.
sure. So, I think, an important thing to note is that I'm a recovering addict and alcoholic. And so through the years I was trying to conceive, I was actively drinking pretty heavily. I wouldn't recommend that, but I told myself, well, when I get that positive test, I'll get sober. But I ended up deciding my husband and I both decided to quit drinking and quit everything in the midst of the fertility treatments and the struggle. So I had been sober for only 3.5 months when I got that positive test. And thank goodness it happened then and not earlier. But I got that positive test on April 17th of 2023. And I was actually in Florida visiting my mother and I remember I had taken a test right before I got on the plane and it was negative. And I told myself, I'm going to wait 3 days before I test again, which I had never done before. Like, I'm delusional. So the day after I ovulate, I'm already taking tests because infertility makes you do crazy things, um, which doesn't make any sense. But I made myself wait 3 days. And I genuinely didn't have a feeling that anything was different. I didn't expect it to be positive, but it was. And I cried, obviously, and called my husband, who was in the other room, and told him to come into the bathroom. And he has really bad eyesight, like really bad. And he was looking at the test and he thought I was crying because it was negative. But I was like, no, there's a line, there's a line. And obviously, like crazy moment. Wish I got it on video, but I remember it like it was yesterday. But yeah, it was, I just like will always remember that joy. And April 17th, like I said, is like it's that really important date. And we also celebrate that day, especially because my son's birthday is right around Christmas. So it's kind of lumped in with the holiday. So we give him April 17th too.
Oh, that's such a cute idea. And especially, like you said, when you go through that journey of infertility, not that anyone finding out that they're pregnant is special, but especially like that's something you've wanted for so long that you
Yeah.
finally get that line. And so
Yeah.
funny that your husband is like, oh, I'm sorry. And you're like, no, it's
Yeah.
positive.
He was like, "What? Oh, what's wrong, honey?" Like, yeah.
That's awesome. So, in those early days of pregnancy, did you have any symptoms like morning sickness or anything like that?
Yes, but I couldn't tell. I didn't get any symptoms until after I saw the line. So then I couldn't tell if I was nauseous because I was anxious because I took about 20 more tests. And so I couldn't tell. I couldn't tell if my symptoms were because I was like adrenaline and excitement and all these things or if they were real. But around the 6, 7 week mark, I did develop like pretty severe morning sickness. I'm not sure if it would quite be in the category of HG, but probably pretty close. It was very severe. And it lasted my entire pregnancy. I was pregnant for almost 41 weeks with my first son. And the morning sickness was not good. Morning sickness, constipation. I developed rosacea, which is still kind of there. It was horrible when I was pregnant. My entire face was red and blotchy. Yeah, so there were some very unexpected side effects in that pregnancy.
Yeah, that's interesting. I've not heard rosacea. I think it makes sense because you're getting more blood flow
Hormones.
everywhere, but
Yeah,
interesting.
I had
Did
never heard of it either.
Yeah.
Yes.
Always pregnancy bringing up new things.
So
Were
fun.
they able to give you any medication or anything for the morning sickness?
Yes, Zofran is what worked for me, like magic. And it does have a side effect of constipation, which is crazy because it's supposed to help with your stomach and then, but so I couldn't tell if the constipation was actually from pregnancy itself because I know that's common or if it was from the Zofran because I did stay on the Zofran the whole pregnancy, but I couldn't eat or move without it, so I needed it. So lots of stool softener, Miralax, and enemas.
Yeah.
Yeah.
That's what we always say. Pregnancy is no longer a glamorous thing. Like you just got to
Oh,
do what you got to do at some point.
yeah. Well, and another thing about the Zofran that I thought was interesting, my OBGYN at during that pregnancy, she was hesitant to prescribe it prior to 10 weeks because there are some indications that it can cause birth defects, I think cleft lip and a couple other potential birth defects. So she didn't prescribe it to me until 10 weeks. So I did have 2 or 3 weeks in there where I was like pretty miserable. But I felt that that was kind of frustrating because I felt like as the patient, you should give me that knowledge and provide me with that information and then let me make that decision for myself because I would have chosen to take that risk based off of how miserable I was. Um, so I really didn't like that. I felt like that choice was kind of taken from me, but I didn't have that OBGYN the next time. So
So, with that first pregnancy, do you mind sharing what your weight or size was when you found out you were pregnant? And did they give you any kind of threshold of how much weight they wanted you to
yeah.
either gain or not gain in that pregnancy?
Yeah. So my weight throughout my life has fluctuated more than most people will ever deal with. When I was in my early 20s, I was only about 110 pounds. I was like a size 2, size 0. And then through my addiction, I rapidly gained a lot of weight. And when I got sober, I was close to 300 pounds. And then when I got sober, the weight just fell off me because I was no longer binge drinking beer. And so the weight just kind of fell off me. So in that 3.5 months between getting sober at about 300 pounds and then finding out that I was pregnant, I think I had lost close to 50 or 60 pounds.
Oh,
I,
wow.
I think I want to say I was about 240 when I got pregnant. And then I discovered in my first pregnancy that I don't gain weight when I'm pregnant. So I didn't gain any weight. I lost weight. And I wasn't sure if that had to do again with like my body continuing to regulate after sobriety or if that was just how my body handled pregnancy. So when you are pregnant and when your belly is growing, but your weight is staying the same, that actually means you're losing weight, right? Because like you're gaining weight because of the fetus inside of you and everything that comes with that, but then the rest of your body has to be getting skinnier.
Yeah, no, that makes total sense. Did your doctor show any concern of the amount of weight gain that you weren't having?
Yes, at first, but every time I would go in to be monitored, everybody was developing fine. So it wasn't a concern, but at first they were kind of like, "Do you like we need to send you to a dietitian?" I think they may have been worried. Nobody said this to me, but they may have been worried that I was not eating. And I was. But what I did discover is I gain weight postpartum. So I'm like opposite. So in the first 2 months postpartum, I gained about 20 pounds. Yeah. So I'm like opposite. And it happened the second time too. So I know that's just what my body does.
Yeah, it's so interesting how everybody's body is so different, and then you throw in pregnancy and hormones and postpartum and how everyone responds differently to it, so that's super interesting. So, throughout your pregnancy, were you happy with your OB care? Was it pretty standard care throughout?
So for the first, I believe it was the first trimester, I still continued to see my endocrinologist. Because of the fertility treatments, they had me do progesterone suppositories. So vaginally, you just put a pill of progesterone up there. And because he was the one to prescribe me that, he saw me through the first trimester. And then I just saw like an OBGYN, but I think I saw like a couple different people. I saw whoever the high risk OBGYN was. Because of my BMI, they automatically classified me as high risk, even though I didn't have any other risk factors, of course. But I think they also just wanted me to continue seeing somebody high risk because of the struggle it took to get me pregnant. But I do remember my endocrinologist telling me getting you pregnant is the problem, but once you are pregnant, we think you're going to be fine. Yeah, but I saw whoever the high risk doctor was, and I guess the fact that it wasn't very memorable means it was relatively neutral.
Pretty
I
standard.
mean, yeah, I
Yeah.
like you know how those visits go. Like you go in for like 5 seconds and they maybe do a Doppler and then tell you you're good to go. But what I will say is I sought out less medicalized care. So I found a group of local midwives and I worked with them throughout my pregnancy. Although I chose not to deliver with them. I saw them for pregnancy care and they had a class called Centering Group, which I think is like I don't think centering is specific to them. I think a lot of organizations have centering, just like a pregnancy group with women who have due dates that are similar to yours, all kind of going through pregnancy together. So I made a lot of friends in that group. Some of them I'm still friends with. And so that was awesome. I would recommend to anybody, like literally anybody, high risk, low risk, anything in between to find um, a less medicalized sort of midwife vibe.
Yeah, and I feel like whereas it is much more common in other countries, it's still not very common to go that route, the
For sure.
midwifery care route in America,
Yeah.
and especially as plus size women, knowing that that is still an option. Did your midwife group have any like BMI restrictions, or were they just happy to take in new patients?
Yeah, they did not have any restrictions. That was like one of the first questions I asked. And not only did I want to know, do you have a cutoff? But I also wanted to know, even if you don't have a cutoff, what is your feeling about people that are plus sized? Like, how do you interact with them differently than anybody else? Like, and so I got immediately such a good vibe from them.
Yeah. For them to be open to that, I feel like is such a special thing. And it does give you a whole different experience through pregnancy. So that is super awesome. So, talk us through as we get to the end of pregnancy. I know you said you didn't end up delivering with them. As you got towards the end of your third trimester, did you end up going into labor spontaneously or how did that unfold?
Yeah, for myself, I was I don't wanna say against because that sounds so harsh, but my very strong preference was to do everything as naturally as possible. So about halfway through my pregnancy, I found a midwife through this group of midwives who specializes in home births. So I planned tentatively a home birth, and that was what I wanted to do. So I was 40 weeks and 5 days when I ended up delivering. I went into early labor about a week prior. So I was contracting on and off for, yeah, like 7 days. Then I had an extremely long active labor. I don't even know if it was called active. I labored intensely for 51 hours.
Oh, wow.
That is a number I will always remember. 51 hours. Um So I ended up not giving birth at home because by hour 39 of like gritting my teeth, my midwife came to my house to check my cervix, which I was at that point begging for because I just needed some hope that things were gearing up to happen. And I was only like 3 centimeters dilated after 39 hours of like every 2, 3, 4 minutes contractions, like
Wow.
constant. So I tapped out because that took every ounce of like grit I had, that took me out. So I said, we're packing up and going to the hospital, folks. So I needed an epidural, like bad. So I went and got an epidural. It was great. I had a good experience with the epidural, and then I labored for 12 more hours with the epidural before giving birth.
Was your home birth midwife able to accompany you to the hospital once you were transferred?
When transfers happen, she sort of like switches her role to become an advocate or a doula. Before she's been practicing for like over 20 years, I think at this point, and when she started out, she was a doula. So she does both.
Got it. So she was very familiar with that role as well.
Yeah.
So talk us through getting to the hospital, kind of change of plans. How was that emotionally, or were at that point, like you said, you were just ready for some pain management?
Yeah, I was like begging for relief at that point. I don't think I could have done it a second longer. Getting to the hospital was hard because for me, laboring in the car and not being able to move was awful. Um, and then getting there, I just kept saying, like, epidural, please, epidural, please. I was like crying. And finally, they gave me the epidural, and that all went well. And once I had the epidural, I was able to sleep and rest. And also, kind of like, I don't want to say mourn or grieve, but kind of like accept the fact that I was now in the hospital and that sucked. But I couldn't have kept going at home. So after the epidural is more so when I was able to be like, this is what we're doing now. Yeah, and my mom actually drove me to the hospital. My husband had to stay home and pack a bag because we didn't have anything packed because I was planning on doing that at home. So he had to stay home and pack a bag, and then he met us there later.
You're like, okay, yeah, please bring that stuff with you.
Yeah. Like, Google a checklist or something and figure it out. So
So
that's it.
once you were there and able to kind of come to terms with now being in the hospital and kind of a change of birth plan, talk us through how birth started for you.
Okay. So I will say I love nurses. I've always, my whole life, had good experiences with nurses, and I have had less than ideal experiences with doctors. And this was kind of no different. So, one of the doctors, and I know this is common practice, but that doesn't mean it should just be automatically expected it's going to happen. One of the doctors every hour on the hour was telling me they needed to break my water. And I still, despite getting an epidural and being in the hospital now, wanted low intervention. That nothing changed about that. So I was like, is anybody in distress? No. So like leave me alone. Leave my body alone. Yeah. So it was like number 2 top of my birth plan to get my birth on video. And I'm so glad I did because a lot of things happened during that first birth in that hospital that were inappropriate and unacceptable. And um lots of this I'm like trigger warning, like lots of like touching me without my consent internally, like fingers inside of me without my consent. When I started to crown, lots of like holding my vaginal opening open. And then there was no evidence of shoulder dystocia. Like it was a very other than the length of the birth, it was a very straightforward birth. And they like yanked my child out of me very aggressively. And I got it on video, so I know what happened. But in the moment, I was so disoriented and out of it, and I did have that epidural, so I couldn't really feel what was going on down there. So I didn't know that all of that was happening until much later when I reviewed all of the video. But I did know that I felt very pressured to do things that I didn't wanna do, and I had to consistently say no, and thank goodness I had my doula there with me because she was very consistently telling them to back off, as was my husband. But it's like, you shouldn't have to do that when you're in labor about to give birth. Well,
Especially if there's no emergency medical need for it. If baby wasn't in distress, if you were having no issues, then the constant pressure is definitely not something that is needed.
yeah. Yeah, it was stressful. It was stressful. And then the actual pushing portion went great. My water ended up breaking as he came out. And I only pushed for about 27 or 28 minutes. So he was ready to come after all that time. So I felt like that was almost like redemption. Like, after so long of laboring, the pushing stage went very quickly and it was relatively easy. And I had only a minor tear, I think like a first or second. It only needed one stitch, and I was pleasantly surprised, but yeah. So that was that.
So, after you birthed him, were they able to put him on your chest straight away?
Yeah, yeah. There was, meconium, probably from the length of labor stressing him out, but there was no aspiration, or is that what it's called? Or yeah, none of that. There was no aspiration or issues because of the meconium. He was just covered in poop.
You're like, "Nah, it's fine. Welcome to motherhood."
Right. And I actually do recall, well, I only know this again because of the videos, because I was so out of it, but like, when they first put him on my chest, I, like, didn't even touch him because I was so like, "What just happened?" Like, it was crazy. Um, and I just remember being like, "I don't know what to do. I don't know what to do with this. I don't know what to do." And, like, my midwife or doula, she was like, "Yes, you do. You know what to do. It's okay. Take a deep breath. Take a deep breath." But yeah, so he was on my chest and I didn't know what to do for a minute. And there were many moments where I was trying to pick him up and I didn't know how. And it was the first 15 minutes were crazy for me, like emotionally, like understanding what just happened. Yeah. And I told the doctors and the nurses, since there's no emergencies and everybody's okay, I want all the checks on me. We're going to do like delayed weighing, delayed exams, all that. Cause I wanted my golden hour.
Yep. And at
Yeah.
least that point, I know a lot of things didn't go to the initial birth plan, but they could at least honor those few
Yeah.
things that you wanted. So that's super
Yeah.
special.
Yeah.
As far as feeding baby, did you have any plans or ways that you wanted to try that?
Yeah. I did hope to breastfeed. And I only discovered postpartum that PCOS and maybe a couple other hormonal disorders cause low supply, like true, genuine low supply. And nothing in the world that I could do could fix that because it's just my body. Um, and so I tried, and breastfeeding it was going okay, as in he was latching well and all that, but he was starving. He was not having wet diapers. He was losing weight. It was it was scary. And so I did start giving formula, and then I just started exclusively pumping. And most days I would only be able to pump enough in the entire day to get like 1 4-ounce bottle. So most of the time I would pump and like nothing would come out. So I cried a lot and talked about it a lot in therapy. And at his 2-month birthday, I quit pumping and just moved to exclusively formula. And it was hard to like emotionally cope with that. But once I accepted it and worked through it, it was a fantastic decision. I was much happier.
Yeah, I know that's an emotional thing. I feel like so many people think about the birth and the pregnancy part and then are like,
Yeah.
oh, breastfeeding will just come easy. And I think it's talked
Mhm.
about a lot more now, but it can be super challenging. And I know for me also, it was probably one of the most emotional parts and the
Yeah.
mom guilt that comes along with it as well. But again, you have to do the best thing for you. And as long as the baby is fed and happy, then that's best for them.
Yeah. Yeah. I think I also got in my first pregnancy, I got a little bit indoctrinated into the like breast is best community. And like even before having the baby, I kind of was like, yeah, like obviously breast is best. Like, I don't know, I got kinda like it's easy to, like, get pulled into it because they're very convincing over there. But I think what that ended up doing was harming me because then I felt like such a failure, and I had my mind so set on doing it this way. And even when I knew that formula was a fantastic option, I was still like, well, that's cool for other people, but like not, but for me, this is how I want to do it. And I don't want to say I blame the breast is best community, but like it definitely had a hand into why I felt so guilty. So I had to work through that.
I
Yeah.
can so relate to that. And I feel like they go hand in hand where I also was looking more into a low intervention, unmedicated birth. And I feel like that community does also lean into like
Yeah,
only breastfeeding. And
for
so
sure.
also my baby had to have formula and had to have supplement because of low supply. And so I
Hmm.
think you can mutually have both where you can do unmedicated and try to do it naturally, but also at the other end of it in the breastfeeding world, if you're not able to supply, there's nothing wrong with your body. Sometimes that just
Yeah,
happens, unfortunately.
totally.
And as long
Mhm.
as you're feeding your baby, it's going to be okay. But I
Yeah.
100% relate to that emotional roller coaster.
I had to kind of understand, like, within myself that formula is a perfectly healthy and nutritionally complete option. Like, there is nothing wrong with formula at all. It's a fantastic alternative. And I mean, there, like, breast milk is still really cool. Like, with this pregnancy, I'm 6.5 months of exclusively pumping. So, breast milk is really cool. And there are a lot of great things about it that formula doesn't have, but there are also a lot of great things about formula that breastfeeding doesn't have. So it's really about each individual family, and absolutely nobody should ever feel bad about giving formula. I'm very much so fed is best mom now.
Sometimes it takes that journey to to be able
Yeah.
to get there for sure.
Yeah. Had to work through it.
Yeah. So, as far as healing postpartum, was there anything notable from your postpartum that you wanted to share with that first pregnancy?
Um, I had a very minor tear and it still hurt really freaking bad. Like, that sucked. It hurt to like sit, pee, all that and more. So definitely like Perry bottles, witch hazel pads. I personally would recommend adult diapers over those little mesh panties that are this big, with the big jumbo pad. Like those things suck. Like get you some Depends. And I just think, yeah, the hardest part of healing was the tear, the stitch and the tear. I would consider myself very lucky that I did not have any type of really postpartum depression, postpartum anxiety, any of that. I think a lot of that comes down to the husband that I chose and the father of my kids. He was absolutely anything that I needed at any given time. We slept in shifts. I was never going to be the type that was up all night and let him sleep. That was not happening. We were going to sleep in shifts. We were also lucky that he had about 6 weeks paternity leave, and that was one of the things we talked about when we were family planning. We probably wouldn't have chosen to have kids had he not had that as an option. So we set ourselves up for success right off the bat with making sure he had a paid leave. I own my own business, so I have that flexibility. And we slept every 4 hours. One would wake up and the other would go sleep in the bed. And then we would switch. And we did that for the first few months until my son like got his little nighttime routine going. So that's what I would say. If you have the capability to sleep in shifts with your partner, that is what you should do. I think it saved my sanity.
We did something similar, and I feel like I give props to the moms who can do it without sleep because I was a horror to be around if I didn't get some sleep.
Absolutely. Yeah, I learned that quickly. I did suffer from I guess I would call it postpartum rage. That would be like the closest to PPD, I think. Um, just like irritable and maybe like angry, but at nothing in particular. It's just like kind of like don't piss me off type of feeling, um, which I'm sure is normal and understandable when you have a complete life overhaul that includes not getting enough sleep and every single part of your routine disintegrating before your eyes. So,
Yeah, that'll
yeah,
that'll do it to you
that'll do
sometimes.
it. Yeah. Yeah.
Got it. Well, very cool. So I guess we will jump ahead then to pregnancy number 2. So were you all planning again to have the babies and go through your endocrinologist again for your second pregnancy, or how did that unfold?
Yes. So we knew that we wanted our kids close in age. I am crazy, so I would have loved to have, like, Irish twins, like, 2 under 1, but I knew I had to let my body heal up a little bit, so I made myself wait till, like, that 6-month mark, which is when my OBGYN told me, like, that's probably, like, the earliest recommended. So I waited until about 5.5, 6 months before we started truly thinking about next steps. And I had a feeling I was going to need to do fertility treatments again, and I was correct. So I did try to go back through my endo, but he had retired, which I was really upset about because I loved him. He was awesome. But I was like his last patient pretty much before he retired. So I had to find someone else. And who I found was the guy who replaced him, who sucked, and I would not recommend him, and he was terrible, and he made me cry multiple times.
Oh no.
It was
That's the
bad.
worst,
No, it was
going
really
from a
bad.
great one to a terrible one.
I know, I was so upset, and I was also really upset because my first meeting with him was really good. He, um he was really, like, jolly, and so he was, like, upbeat, and so he made me feel comfortable, but he was highly flaky and pretty unprofessional. So he would tell me it would be in my chart, like, "This is the plan, these are the dates, this is the next steps." I would set up my appointments, I would pick up my prescriptions, I would do all the things, and then we would get there, and he would push me out weeks. And, like, when you are dealing with infertility, even one, like, second that you're not pregnant is, like, agony. And he's telling me we need to wait weeks and months and months. So the first 2 times he did that, I waited the couple of weeks, went to the appointment, and then he did it again and again. And by that 3rd time that he pushed me out again and told me, "Don't start your regimen yet, we need to wait." And there was also, like, no reason he was telling me to do this other than, like, you had to get, like, an ultrasound on one day, and then exactly 1 week later, get another ultrasound, and he was not properly booking out my appointments. So he would book me for my first ultrasound, and then there'd be no openings for my second ultrasound the following week. So he'd say, "Oh, we have to wait till next month when we have 2 appointments a week apart." And then we would wait that month, and then he wouldn't properly schedule my next appointment. And I had my prescriptions, like, I was doing my things. Yeah, and I also, at this point, my son was only 5 or 6 months old. Well, when I started, my son was only 5 or 6 months old. So my son was under 1 going through this, and I'm his primary caretaker. So I'm, like, hauling a one-year-old an under one-year-old to my appointments with me to be turned around and, like, left crying essentially and disappointed. It was really difficult. And I was also driving 40 minutes because that's where the clinic was. So, like, an 80-minute round trip just to be told, like, haha, just kidding, we're not doing this today. 3 times. So 3 months in a row. Um, That was so hard. That was so hard. And, like, the last time it happened, my husband, like, yelled at the doctor. They, like, got into an argument because he was tired of seeing me leave those appointments crying, and so he came with me. He, like, took off work to come with me to, like, see for himself what was going on. Um, yeah, and it sucked. It all sucked.
That's crazy. So that last appointment, was he able to confirm, or did you end up seeing a different endocrinologist?
I went somewhere else. I yeah, I told him to go fuck himself and, like, walked out crying again. And I found a different person. So, I found a women's clinic. I went back on the same regimen that got me pregnant the first time, which was the Letrozole and the Gonal-F injections. And I was being monitored closely, but sometimes with fertility treatments things like multiples happen. And that is how I ended up pregnant with triplets. And they think I released 3 different eggs, like, possibly on 3 different days, because at the time of the sex, it didn't look like 3 eggs were going to release. There was 1 dominant one and a couple other trailers, which is what happened the first time. So they think just by chance 2 other eggs caught up and released, and they were all inseminated. And
Wow.
we didn't even do IUI this time, we just did it the old-fashioned way, and I ended up with 3. So
That's
that was crazy.
a crazy experience. So talk us through, so
Unbelievable.
obviously you were monitoring again pretty closely.
Yeah.
Were you still with the women's clinic when you found out it was gonna be triplets, or talk us through finding out for the first time that there were 3?
Okay, so again, I was taking pregnancy tests like a crazy person. And at like 7 or 8 days post ovulation, I had a negative test, which is normal, even if you are pregnant, because that's very early. And so I again was kind of like, well, I guess, we're going to have to do another cycle again. Cause I think this was my third or fourth, I can't remember exactly, but this was my third or fourth time doing this with the women's clinic. So I was just like, okay, whatever. And then something told me to just take another test because this was right around my son's first birthday. And he was born on December 29th, 2023. So now we're around the end of December 2024. I had had a miscarriage earlier in December. So I had gotten pregnant. I had gotten a clear line. And then I got my period. So I was I was miscarrying around like December 13th or 14th. And then I'm assuming it was just a chemical pregnancy because it was so incredibly early. There's no way anything happened other than it being a chemical pregnancy. I considered that a period. We were just considering it a period. And so I just started the next round right then and there. Um, And then I remember telling myself, like, dang, I'm so upset. I'm not going to be pregnant, like bringing this baby into the new year. Like, I'm so upset. And so on on New Year's, the last day of December, I took a test and it was negative, and I was so upset. And then on January 1st, I took a test and it was negative, and I was like, dang, like, this sucks, man. And then something told me to take a test on January 2nd, and that's when I got, like, the faintest positive. Like, only a crazy person like me could even see the line. And I was like, "Oh my gosh, like, I got my wish. This is crazy." But then, of course, coming off of just getting a positive and then immediately losing it so quickly, I was very nervous and, like, I was very nervous. So I booked all that to say, I booked an appointment with a private ultrasound clinic right down the street called Little Bellies. They're like a franchise all over the United States. So I booked with Little Bellies, and it was January like 10th or something. And so, like, not even a full 4 weeks since, like, day 1 of my menstrual cycle. So, like, how how many days post-ovulation would that even be?
Like 2 weeks, 14 maybe?
Like, not very long, like,
Yeah.
that those embryos had probably just touched the lining of my uterus and, like, not even implanted yet. The timeline was so, like, boom, 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 quick, quick, quick. Um, yeah, no, I'm like sorry, I'm thinking I do remember now, I took my trigger shot on December sorry, I'm, like, all over the place. I took my trigger shot on December 24th. I remember it was Christmas Eve is when I triggered ovulation. So and, like, if I ovulated more than 1 egg, who knows if it was, like, 23rd, 24th, 25th, 26th, like, multiple in there. Um, yeah, so expecting a positive test on December 31st when I just triggered ovulation on the 24th is psychotic, but, um, yeah, so I think it was, like, January 10th, so they couldn't see anything, but they saw 3 empty sacs, which for that stage of gestation is normal, like, you're not gonna see the fetus, the embryo yet. So yeah, they saw 3 they actually saw 4 empty sacs, but 1 was determined to be a hematoma, what's it called? Subchronic hematoma?
Yeah.
It was a hematoma. So a blood clot, essentially. Um, and then so at first, we were like, 1, 2, 3, 4. But then she was like, no, that's a hematoma, but we do see 3 empty sacs, and you need to come back in 2 weeks so we can figure out what's going on. So instead, I booked with a different ultrasound tech the next day. So I didn't wait nearly 2 weeks. Um, and she confirmed the same thing, 3 sacs. So I waited then 1 week and went back again. We saw 3 embryos, and, they all had heartbeats, and they were all there.
Was your husband with you at those appointments? And what was the conversation like when you initially saw the 3 sacks?
Yeah, we knew we weren't interested in that. We knew we weren't interested in that. Um, we had discussed years before I ever even got pregnant, the possibility of multiples given my infertility. And anytime you do any type of fertility treatments, it automatically increases the risk of multiples. That was something we were highly aware of and had given much thought and discussion to. And the conclusion that we always came to was twins is not ideal, but we could do it. Triplets is not happening. No. So when we had that discussion, I being me, looked into options of what would somebody do if they were pregnant with higher order multiples and didn't want to be. And that's when I learned about fetal reduction. So I had already known about fetal reduction for many, many years before I ever thought I would actually need one. I thought it was just I thought it was just like a Jeopardy fun fact. Who expects that to happen to them? So after we confirmed that there were 3 actual embryos that were alive inside of me, it was maybe a 30 to 40-minute conversation of like, what are we going to do? Are we going to really have triplets? And then by the end of that very quick conversation, I had already made my decision that I was going to get a fetal reduction.
Well, I know that couldn't have been an easy decision, but one that
Yeah.
was best for you and your time.
Mhm.
Were you concerned with finding an OB who would support that, or what did that journey look like moving forward with that procedure and medical care?
So nowadays, least from my understanding, don't quote me on this, but from my understanding, it's one of the recommended options for higher order multiples that you consider a reduction. So I wasn't concerned about being supported through that. I just knew I needed to find somebody quick to have a consultation with. Um, so at this point, I had sworn off Metro Health because of that terrible endo, and I moved to UH. And I had a much better experience, I would say, overall with UH. Um, and one of the people I found at UH was an MFM who is one of the only doctors in Ohio that does fetal reductions. So she did my consultation with me. And at this point, like, I had obviously sought her out with the intention of having a fetal reduction, but she was sort of coming to me from a place of like, this is an option and let's go over the risks and the benefits and blah, blah, blah. And I was like, yeah, we don't have to discuss any of this. I'm already on board. Let's schedule it. Cause I was just so like, I had already made the decision in my head. And at this point, it was just playing a very painful waiting game of knowing I had to be pregnant with triplets and sort of wrestling with myself of how attached do I really want to get here because this is such a wanted pregnancy, but the circumstances surrounding it are so not ideal. And I just wanted to get everything over with. So I was like, sign me up. Where's the consent form? Let's go. And at this point, I was probably only about 7 or 8 weeks pregnant. And she told me I had to wait until 13 weeks and that they wouldn't do it before then. So that was really hard. I was pregnant with triplets for my entire first trimester. I was very sick and huge already. And it was emotionally and physically a lot of turmoil that I went through.
So, what was it like once you did get to that 13-week mark? Did you have an appointment for the procedure already booked in and you were just waiting for
Yeah.
that date?
Yes, exactly. So 1 week less, maybe 3 days prior, they did an ultrasound just to sort of map everything out and decide like who they were going to go for. So I had that ultrasound. We made a plan of action. And then I just, again, had to wait for the appointment. And I went in pretty early in the morning and they did the procedure.
And was it a pretty non invasive procedure? It was pretty easy afterwards, or was there any concern with the care of the other two post that procedure?
So it it was it was a relatively quick and easy procedure. And I was I was not that scared only because having a fetal reduction is so incredibly, like, statistically safer than carrying triplets to term. So it gave me less anxiety to think about that than it gave me to think about having triplets or being pregnant with triplets. So there was like 15 people in the room. There were 2 or 3 MFMs, a bunch of nurses, an ultrasound tech, and one doctor held, or it must have been the ultrasound tech held the probe over my stomach to see where everybody was. And then one doctor was in charge of the pain management. So there was a big needle full of lidocaine, I believe. And every so often I had to get another jab of lidocaine. And then the other doctor was dealing with the needle that had the, what is it called? Oh my God, I like can't remember the name of it, but it's like a
A
something something.
specific medication.
Yeah, it stops the heart. It's a medication. It held the medication that stops the heart of the fetus. Um, so there were so many hands on me, and that was probably the most uncomfortable part. You have to lay down flat on a table, and then they tilt you sort of like with your head down. So, like, your abdomen and, like, lower half is sort of, like, slanted up, and so I was almost, like, halfway upside down. So, like, blood is, like, rushing to your head, and it's that was the worst part, was not being able to move, being in a really uncomfortable position, and all these people that I didn't know touching me and probing me. I couldn't feel anything because I was numbed. They thought I was really weird for this, which I understand, but I did ask to watch. Not for any, like, sick reason, just because I wanted to understand what was going on in my body. And so I did watch, and I could see not only in front of me, but on the screen, the needle going in. And, um, trying to access one of the fetuses. And I talked about this on my TikTok, but the procedure is supposed to only be between maybe 5 and 15 minutes. It's not supposed to be a long procedure, but they couldn't reach the fetus that they were going after. And that's because what they said, that's because of my BMI. I have a lot of stomach fat. I have a large stomach. Um, so the needle wasn't long enough to get through the layers of stomach fat and get to the fetus they had intended to get through. So about 50 minutes in, which is so much longer than most of these go, they changed course and went for a different fetus. And then that was successful very quickly within 10 minutes. And that was really hard for me because mentally I had gotten attached to the idea that it was going to be this one. And even though to me, they were just 3 random fetuses at this point, like, they weren't the children that I now know and love, um, I had just emotionally gotten attached to this idea. And so that, like, very quick turn, I just felt like I, like, lost the control that I had in that moment, and I did lose the control I had in that moment, so I just told them, "Do what you need to do. Just hurry up and get it over with," and they did. They hurried up and got it over with, and, then I asked everybody to please leave the room, and then I broke down and cried because that was a really hard experience. Yeah. And then I got it together, and then I was okay, but at first it was hard.
Yeah, and even though you knew it was the right decision for
Mhm.
you and your health and the baby's health at the time, it is still that mourning process because, like you said, it was very
Yeah,
much a wanted pregnancy and going through
yeah,
that procedure, so I can definitely
mhm,
understand the huge emotional toll that that takes afterwards.
yeah, yeah, totally.
So what was it like post that procedure? Did they say, "We wanted to monitor the other 2," or what did that look like?
Yes, so the way they do things is you come back in 1 hour and then again in 2 hours to make sure that the other fetuses are okay and to also make sure that the procedure did work. In very rare instances, um, the heart is not injected with enough of the medication and they have to go back in again. Luckily, that was not the case for me. That would have sucked, but that's why they do that monitoring. Um, so during the procedure, I was mostly very quiet, breathing deeply, sweating a lot, and just trying to stay focused on getting through it. And at the end of the procedure, the doctor said, "You did really good." Like, she was a little over the top at how, calm I was, and she was like, "Most patients sort of experience a little bit more discomfort than what you experienced." And I was kinda like, "Oh, like, you're gassing me up because that was just really hard for me, like, I'm sure you say that to everyone." And she was like, "No, seriously, like, we expected a little more discomfort from you." And I was like, "Okay, I got off lucky. Great." So then they literally tell you, "Go to the food court, get some food, wait for an hour, and then come back." So that's what my husband and I did. And so I was shaky, walking slowly, breathing deeply, trying to keep it together, but he went to check out with the food and I went to find a chair and sit down. And then out of nowhere, I experienced like contraction level pain to the point where like I was hunched over in public, like there are people around, and I was like hunched over, groaning, moaning, and screaming in pain. And I am like not the type to that was very out of character for me. Let's just say that. I'm not gonna make a scene in public. And I could not even control it. And my husband had my phone. My pants didn't have pockets, so my husband had my phone, so I couldn't even text him or anyone to be like, "I need help." And he came back after he had checked out, he, like, came back and saw something was wrong, and, like, my face was, like, gray, like, it was, like, white gray, and so he, like, essentially carried me back to the office and got me in there. And this was only 15 minutes after the procedure. And they very quickly opened up an ultrasound room for me and got me into the ultrasound, and everything ended up being fine. And I still don't really know what happened there. But the doctor said that's more along the lines of what we expect during the procedure. So she said that I still had a much more severe reaction. Like, it's not supposed to be contraction level of pain, but it's supposed to be like a little crampy, like a little something is prodding your uterus. So it's supposed to be a little crampy. But she said that um, she could only explain it like my uterus just had a very delayed reaction, a very intense delayed reaction. So
Interesting.
that was really scary and not expected by anybody on staff either. No way to really explain it. But so I guess I just like, if anybody else is going through a fetal reduction, even though that was my story, I wouldn't expect that to happen. She said that was out of character, but it did happen to me and it was scary.
Yeah, for sure.
Yeah.
So once they completed that other monitoring the rest of that day, how
Um,
did the rest of that pregnancy go for you?
Great. I mean, hard, but like good. Um, they said, I had to be on pelvic rest for 1 week. So no sex, no masturbating, no, uh, baths or hot tubs or anything, and I couldn't lift my toddler. So I had to be really careful for a week. But then later that month, I ended up going to Florida to see my mom again, and that was what we sort of considered that like our baby moon. It was like our last hoorah before never being able to leave again. I noticed because like I went from 3 to 2, I was huge in my first trimester, and then for the next like 2 or 3 months, my stomach's just sort of stayed the same size. Like it didn't really continue to grow. And then around the end of the second trimester, I got much bigger. But that was a little, I wouldn't say I was scared because in my head, I logically knew that that made sense, that, that growth made sense. But it was a little kind of like, okay, I was so big and now I'm not. Like, is everything okay? But everything was fine.
Yeah.
And I would say like, I love being pregnant, so, like, I'm always gonna say my pregnancy was great even if it actually sucked because I romanticize it. Um, but yeah, I had a good pregnancy. I was really uncomfortable, obviously. Um, I had carpal tunnel towards the end in my wrists, another pregnancy side effect. Um, yeah.
Did you continue seeing the specific MFM doctor throughout the rest of pregnancy, or did you transfer back to just a normal OB?
I kept seeing the MFM, and there were 2 of them actually that I saw. Both were awesome. Really, really good.
How was that compared to your first kind of plan of doing very low intervention and going the midwifery care to then obviously having to have a little more medicalized care because of
Mhm.
multiples and things like that? How did you find the balance in the two worlds, so to speak?
I still plan to do a home birth again. So I was like, I'm going with the same midwife that I used the first time. I Some people during pregnancy have co-care between like 2 separate, like a midwife and a hospital organization. I had TRICARE both pregnancies because I was going through the hospital, the midwife group, and then my private midwife. So I was covering all the bases, right? But I saw the hospital for like the blood draws, the tests, the ultrasounds, like that type of thing. And then I saw the midwife group for like community and friendship and support like that. And then I saw my private midwife for home birth preparation. So those were the angles. So I feel that I did a pretty good job of managing like the tests, the blood draws, all of those things that you need to have, while still getting like a really highly personalized approach from the midwives that I saw.
That's awesome. So you were still able to keep kind of that model of care in
Yeah.
mind, even with getting the extra monitoring on the hospital side. That's really great.
Yeah. It was. It was great.
So, with multiples, did they give you any indication of we would like them to come between these dates a little earlier, or how did that conversation go?
Yeah. It is It is both my probably greatest attribute and my one of my biggest faults that if I have my mindset on something, it's highly likely that that's what's going to end up happening. Um kind of regardless of circumstances. Like I am very in charge of my own life. Um so when they said you're going to have to get induced, I said no. And then they were like, "Well, this is just kind of how we do things." And I said, "Oh, it's not how I do things." And that's kind of as far as the conversation went. I just kept saying no. Unfortunately, they continue to prod and like they bring it up 5 million times, but I just kept saying no. And then if there was ever pushback, I just pushed back and I would be like, I would like you to provide me with all of the information that you have on why this is your recommendation. I'm never going to settle for it's just policy, which ended up being like the answer to the vast majority of these recommendations and these interventions. It was hospital policy. Why can't I have a video of my birth? It's hospital policy. Why do you recommend 38 weeks when it's this BMI? It's hospital policy. And I just wasn't going to go for that. So there were some things though that had a better answer than hospital policy, like actual studies that were done. For instance, when it comes to having twins via vaginal delivery, it is statistically shown to be safer when the first twin is head down. And I had to do a lot of soul searching about how careful did I wanna be? What advice did I wanna follow? And what support could I find for myself within the rigid medical guidelines that would support a vaginal delivery even if I had breech twins? Um, and I ended up just sort of letting them know to have a high risk doctor trained in breech delivery on staff when I get there, because unless someone's life is in danger, I will certainly be delivering vaginally. And I did.
I mean, through your whole story, advocacy, I think, is the
Yeah.
biggest term of being able to know what your options are. And
Oh,
then
yeah.
even in a hospital system that is pushing certain things, some due to medical studies or reasons, but a lot of it is hospital policy or practice
Yeah.
policy, to be
Yeah.
able to know that you can speak up for yourself, or if you're not comfortable having a doula or a partner, be able to speak up for the things you want to get in your birth. So I think that's a huge green
Yeah.
flag.
Yeah. I think people don't understand that you as the patient, you as the person who is pregnant, you always have a choice, always. And they as in hospital organizations and the staff that work there can make you feel like you don't have a choice. They will tell you we are going to schedule you for an induction or a C-section, or we are going to give you the glucose test, which I took like I'm not against that. It's just an example. Some people don't want to do that. You always have a choice. Um, and it's so important for you to ask why. Like, why are we doing this? And if they give you an answer that doesn't really sound that convincing, ask them why again. Just like keep making them explain themselves, because I guess the way that I thought about it is like you are my doctor, like in a way you work for me. Like not it that sounds like dictatory, but like you are supposed to be of service to my medical needs and wants. And so you're not supposed to just be telling me what to do without giving me a very legitimate reason for why we're doing the things that we're doing, especially when it comes to something as like, in my opinion, like sacred as giving birth. Like people should be really in charge of how they give birth, I think.
Yeah, absolutely. I agree
Yeah.
100%. And I think medical offices can be super pushy in certain situations, especially with plus size moms. And if you're comfortable going forward with what they're saying and recommending, then you get to decide what you think is
For
best for
sure.
you. But also,
Yeah.
if you want to push back a little bit on what they're saying, you have that right to do so as well,
Always.
for
Yeah.
sure.
Yeah.
So, did you get to do a home birth or how did that wrap up at the end?
No, because my water broke before 37 weeks. So my midwife has like a pretty strict rule for all births, singleton, etc. Before 37 weeks is an automatic hospital transfer. And then also given the fact that both of my twins were breech, I probably would have made the decision to go to the hospital anyway, just in case. And she definitely would have been in support of that. But yeah, so my water broke spontaneously at 36 and 5, which was so different than the first time around. Like I said, my water broke as my son came out of me the first time, and, this time it just broke. There was, like, nothing leading up to it. I had gone to work like normal. I We put our son to bed like normal. I laid on the couch, and I literally remember saying, to my husband, like, this really sucks because I don't feel anywhere near done with this pregnancy. Like, I literally was like, I'm so tired. Like, I hope I make it to 37, but I don't want to go much further than that. And then, like, 2 minutes after I said that, I felt like, it felt like a very strong kick against my cervix. And I leaked water all over my couch. So that was crazy. And I panicked because I was like, "Oh, this isn't supposed to be happening right now." Nobody was expecting my water to break that soon. So, um everybody thought I was playing a prank on them. Like, I called my best friends, and my mom and my midwife, and nobody thought I was serious, but I was serious. And my midwife was technically off duty for me because, again, like, it was not yet 37 weeks. And so she was like hours away, in another city. So she was like, "Shit, like, okay, let me get in the car and, like, I guess I'll start driving towards you." And I was like, "Oh my god, like, what do I do?" And she was like, "You have to call the hospital and tell them that you're coming and that your water broke." It's like I was like, "What if you don't get here in time?" Like, oh my gosh. This was August 15th. My mother was set to arrive in Ohio on August 18th. She was driving from Florida. So she was literally like gonna be getting in her car like within the next 12 hours to drive to Ohio. Um, because my due date wasn't for like multiple more weeks. So she was gonna come on the 18th and then just stay for like a month.
And she thought that was plenty of time. Oh, it's
So
weeks
we
early.
all did. We all did. So my water broke, and she ended up missing my birth, which sucked so
No.
bad. She was in the car driving. From start to finish, my birth was only 5 hours and 21 minutes from the time my water broke to the time the second baby was out.
Oh,
So
wow.
again, we're talking 51 versus 5, and we're talking days, if not weeks of contractions versus water breaking spontaneously and then just a few hours of contractions. Like it so starkly different.
That's
Um
wild. So did your
yeah.
contractions pretty much immediately ramp up once your waters broke?
No, it took an hour. I was sitting there like, let's get this going, you guys. Like I was sitting there for an hour. Um My mom was supposed to be there to help with, like childcare for my older kid, and so I was, like, calling my friends, and this is, like, a Friday night, so, like, some of my friends were, like, cozied up at home with a book, and others were, like, out, at a bar or something, like, so I was, like, trying to find somebody to come over, um and one of my friends ended up coming over to stay with my son, and she cleaned my couch for me, which was very nice. But she came over to stay with my son, who was already in bed, so it was easy. And then my husband packed the car. Again, no bag packed. Not because I thought I was gonna be doing it at home for sure, but because I wasn't ready. I was not ready to be giving birth yet. So my husband ran around the house again and packed a bag and then got me in the car and he drove me to the hospital. And on the ride there is when contractions started ramping up. And I remember as we pulled up to the hospital and got out to walk in, I remember saying, if we're only like an hour and a half in and my contractions are this bad, I'm going to need an epidural like immediately as soon as we get up there. And thank God I had that foresight, because by the time I got to like walking down the hall to get up to the room, I had to stop pretty frequently to hunch over and breathe through. And we're only like 2 hours in. And I'm like, how did I make it 39 hours the first time? And right now I'm like, we're 2 hours in and I'm like, I can't do this anymore. It was crazy. I was like, my mind couldn't catch up with what was happening to my body. I was shocked. So we got up to the room. I stripped naked. I was all over the place, walking around, hunching over, sitting on my bouncy ball, begging already for an epidural. And those contractions, they just kept coming. They were hitting so hard. I threw up a couple of times from the pain. I couldn't sit still enough for them to get an IV in me. So all of my veins were getting blown out. Like, it was a mess in there. And all the while, the doctors are like in my ear, like, we need to wheel you back for a C-section. And I was like, no, I'm doing this out of my vagina.
And
Um,
was that just because they were breech presentation, or were there any other reasons?
No, just because of Breech. My baby A was Frank Breech, so like booty down and legs like up here. And then my baby B was like sideways on top of her. Like I always say, like, she was wearing him like a hat. So because of that presentation, they were like, we need to wheel you back like now. And I was like, but there's no emergency, you guys. And I would like to make this statement. I feel like people hear my story and they think I'm like anti C-section or anti induction, and I'm absolutely not. Like, I think any way that somebody wants to give birth is how they should give birth. And if they can't do it the way they want to, any way that gets everybody's out safe is the way that it should happen. Like, I have nothing against C-sections. I just didn't want one for myself. I have friends who have had emergency C-sections and elective C-sections, and like that is perfect for them. Just didn't want it myself. Um, so this all happened around like 7. My water broke at about 7 p.m. By like 8:30 p.m., we got to the hospital and I'm screaming, begging for an epidural. I probably didn't get an epidural until 10 p.m. And it was hard. It was I was just about clawing the nurse's skin off. Yeah.
Had they done any checks to see if you were dilated, or because your waters broke, did you
Yeah.
hold off on that?
No, they did. I said that that was okay. I wanted to know what was going on. And they could I was dilating quickly. I was like at 4, then 7, then 8, then 9, like pretty quick, but they couldn't exactly tell what was going on because there was like a booty and a thigh, coming out. So, yeah. I would say I think I was about 7 centimeters around 10 p.m. when I got the epidural. And then I was like, again, same experience after I got that epidural. Things were looking good. I was ready to take a breath, figure out in my own head what was going on, and really like mentally prepare myself for what was about to happen. And that's also, unfortunately, when the doctors took the opportunity to scold me about not having a C section. And I ended up letting the doctor know, like, I I hear what you are saying, and I am letting you know right now that I'm done talking about this. I will not be having a C-section unless somebody's life is in danger. And if you let me know that I'm going to die or one of my babies is going to die, immediately I will say yes to a C-section. But until then, I'm giving birth vaginally. And so she then marked it in my chart at like the timestamp, like patient is no longer willing to discuss a C-section. And then it wasn't brought up again. So it only took like 9 months.
to
Um,
convince them that.
yeah, it's exactly. But like the thing is, like, I'm not delusional. I understand why they were pushing that so hard. I just wish that they would have also acknowledged that I looked into every single last resource that they provided to me. I wasn't just like on Google being a keyboard warrior, like looking at my own. I was asking them for research and studies and statistics and their own as doctors' personal anecdotal experience. And I was taking that all in. I was looking through everything. And I mean, like, I probably read through like 50-page documents. And then I still came to the conclusion that I wanted to come to. Um, and it ended up working out great. But oh, and my midwife made it there just barely, just barely in time. She arrived at like 11:45 p.m. and I gave birth at 12:18 a.m. and 12:27 a.m.
So, how did the pushing phase go with them being breech?
It was crazy. So they took me to the OR, which I was totally fine with just in case of emergency. I was like, let's go. So I was in the OR and my husband once again got it on video. So with my daughter, baby A, um, I think I only pushed like 3 times. She shot out, that girl, folded in half, booty first, and feet up by her ears. Um, and then her cord was, like, literally, like, this long. Like, it was, like, so short, and so it couldn't come up to my chest. She, like, hung out quite literally on my fupa, like, she was down there, um, and she hung out there, and I told them to delay cord clamping for as long as it took until the cord was white and no longer pulsing. Because a lot of the times they'll do delayed cord clamping, which is, like, 30 seconds, but like, that's not really delayed. So anyway, so, um, they waited to clamp, and then they went in for baby B, who was transverse sideways. But after, baby A came out, he was, like, all over the place, like, kinda bouncing off the walls, and they couldn't figure out what was going on with him, so they had to do a breech extraction. He also had, like, a minor cord prolapse. It came out just briefly and then they pushed it back in, so it was fine. Um, but yeah, they had to like reach in my by they, I mean one specific very tall man had to reach in through my vagina into my cervix and kind of fish around in my uterus and like grab a foot. Um, and they pulled him out by his feet. So insane.
Wow. Just that visual of like what's going on. And like baby B was excited that he had all of that room that he hadn't had for
Yeah,
9 months.
using my uterine walls like a trampoline. So
That's great. So they were able to get him out okay.
yeah.
Because they did come early, was there any talk of them needing NICU time, or were they healthy weight and all of the checks there?
So they were fine when they came out. They were both 4 pounds, 13 ounces. They were both the same weight. Um, so she came out easy, like, she was ready to come out. She was also the one that, like, popped my water, so she was ready. Now, baby B, because of the breech extraction, he was, like, a little bit more stunned, so he was still okay, but they took him to the back room. I'm not sure what they did back there. I think maybe they had to, like, suck out his nose or something, I don't know. It took him a minute to perk up. Um, so I hung out with baby A for a little while. They took care of baby B. It took like 3 minutes for them to do what they needed to do, and then they brought him back as well. And at first, they were great. Around 10 hours of life, they started some like blood sugar issues that they think it was because they were early. They were just having issues regulating their blood sugar. And so we were feeding instead of feeding on demand, we were feeding on a schedule. And I was pumping, and so I was feeding them my pumped colostrum. And they were still having the issues, so they gave them this like oral sugar gel, and then that also wasn't working. So they had to take baby B to the NICU at around 10 hours of life. And he was only in there for, I don't know, a day, maybe 24 hours, maybe. Um, and a few hours later, they had to take my girl up to the NICU, and she was only in there for a couple hours. And then they both were able to hold down their feeds, their blood sugars regulated with the amount of milk they were taking, and they were both able to come home with me. So that was the only issue. I was so lucky. They were on room air, so they didn't have any breathing issues, and there was no issues associated with the way they came out either.
That's
Yeah.
great because I
Uh,
know generally a lot of twin pregnancies end up with a lot longer NICU time. So that's great that they had a very
yeah,
minimal time there. So they
yeah,
both were able to come home with you when you got discharged as well?
yes. Day 3, I think. And, it was kind of confirmation how the birth went. It was kind of confirmation that the fetal reduction was the right choice because if my water broke at only 35 weeks with twins, it probably would have broken. I mean, there's no way to know for sure, but my speculation is my water probably would have broken much sooner with 3 in there. Um, and then who knows what would have happened with, NICU time and all that. But, like, kind of the way my birth went was confirmation that I made the right choice.
Yeah, that
Yeah.
everyone was happy and healthy and able to go
Yeah.
home. Yeah, for
Yeah.
sure. So
Yeah.
talk us through those early days postpartum. How was your healing this time? Did you tear any?
I don't know how, but no, I didn't. I thought for sure that man being like elbow deep inside of me was gonna tear me for sure, but I did not. My healing with the twins was much easier than it was the first time, which is shocking, but yeah. And I think it's because of the fact that I didn't tear, like, my vagina was fine. It was maybe a little sore, but not in any memorable way versus the first time, I remember it stinging bad. I would say my pelvic floor was a mess for a while. Like, it was, if I lifted something too heavy, if I bent over in a certain way, like, a lot of pain in my pelvic area after the twins. And honestly, during pregnancy too, they were so heavy that I could tell my pelvic floor was going through it. But now about 6 to 7 months postpartum, it feels much better.
That's good. Did you just do some at home exercises to help with that, or did you see a pelvic floor physical therapist?
No, I know I should have, but I didn't. I couldn't get it together to do that.
You had a lot going on with some new babies,
Yeah.
so understandable.
Yeah.
And I know
Yeah.
you mentioned a little bit as far as pumping colostrum early on, and then I think you said you were exclusively pumping for a while. Do you want to touch a little bit on that journey with this second pregnancy?
Yeah, so it started out much better this time around. The first time, like I said, I had such a low supply, like drops when I would pump. This time, I actually was able to fully feed them breast milk for nearly 2 months. I was pumping for them. I was also like feeding them from the breast. First of all, with twins, that was extraordinarily difficult. It is possible, but it was very hard. And then when they were about a month old, they both got thrush. And I was honestly like scared to give myself thrush in the nipples. So I stopped breastfeeding and I just continued to exclusively pump. And I know there are strong opinions on breastfeeding versus pumping. But for me personally, pumping has always been easier. It's always been easier. It is on my timeline, my demand. I get to set my schedule. Other people can help with bottle feeding. And we have a bottle washer for pump parts and bottles. So that eliminates the washing, which is the hard part for a lot of people. So pumping has been great. Um, and this time around, I was a lot more educated on like other methods of feeding and milk production and all of these things. So instead of the formula route this time around, I went with donor milk. So when my supply started to deplete and I had to supplement, I found a few private donors who were overproducers and gave me some gave for free. Lots of people have given for free, which is awesome. Others have sold it to me for anywhere from like 25 cents an ounce to 50 cents an ounce, somewhere in there. And so I have been able to feed my twins exclusively with breast milk for their whole life, which is pretty cool. And then I've also like given my toddler breast milk now too, which is cool because I feel like that journey was cut so short. So it's felt good to like give him my milk again. And when my supplies started to dwindle, I started a medication called Domperidone. And I did not know about that the first time around, or else I probably would have tried it. It's not the go-to medication in America. In the USA, it's Reglan. But when I looked into both of them, Reglan seems to be less effective with more side effects, and Domperidone seems to be kind of the go-to everywhere else in the world. And America's just really behind on that. So I found it through a Canadian online pharmacy, and I didn't need a prescription because it's like essentially an over-the-counter medication over there. So I found a lactation consultant that is also a physician, and she was able to order an EKG for me because one of the possible interactions with domperidone, if you are on SSRIs, is a heart thing, and I am on Lexapro. So I got an EKG, started domperidone. It worked really well, like almost within 48 hours, there was an increase. And then I've been monitored with EKGs every couple of weeks since I started that. Um, but I am planning to wean. I'm actually in the process of weaning right now. Like I'm weaning my pumps right now. And on their 7-month birthday, I'm gonna stop pumping.
And that's a huge feat making it that long anyways. Yeah.
Yeah, totally. And it's like this time I'm making the decision and I feel ready versus the first time around. I felt like it was kind of taken from me. So I feel good about it
Yeah.
and I'm ready to be done.
Yeah. That's a very redemptive experience with
Yeah.
breastfeeding this time. So that's super special.
Yeah, totally.
Well, awesome, MaRiahh. I know is quite the journey from fertility and then through both pregnancies. So I really appreciate you sharing all of your journey and all of the research that you did. Are there any resources that you particularly found helpful that you would like to share?
Yes. Lots of social media like accounts. There are two Instagrams that helped me make informed decisions about my birth. One of them is called Badass Mother Birther. And another one is called Breech Without Borders. And Breech Without Borders is a whole organization that educates on breech birth. There's also an Instagram page. I believe it's literally just called Plus Size Birth. They post a lot of great resources and also like pictures. It's great representation of plus size pregnant women and pregnant people. Because I remember my first time I was pregnant, I didn't see anybody that looked like me that had a baby bump, and so I sought out those types of pages, and one was helpful. So I would say those 3 pages are good, but also with Badass Mother Birther, she posts, like, full birth videos, so only go there if you want to see that.
Being able to like you said, find other people that are going through something similar as a plus size woman. That was
Yeah.
very helpful for me as well. And I know
Mhm.
you have shared quite a bit of your journey on social media as well.
Yeah.
So, do you want to share where people could find you?
Sure. My TikTok and Instagram are both #bandit.
And we will link that in the show notes as well. So anyone could go and see your content and then reach out to you as well. But really, I have enjoyed so much speaking with you for the
Me too.
podcast. And hopefully we get to connect further down the line.
I would
Um,
love to.
but yeah, thank you so much, MaRiahh.
Thank you so much for having me.
Thank you so much for spending part of your day with us. If you enjoyed this episode and want more stories just like this one, please be sure to like and follow us wherever you listen to podcasts. Also, if you have a moment, please consider leaving us a positive review wherever you're listening to the show. These reviews are the best way for the algorithm to push out our show and get us in front of other plus-size moms who may be looking for a community like this one. Your kind words can help make sure that no one has to go through this journey alone. If you are a fellow plus-size mom and would be interested in sharing your story, please reach out to us at biggerthanbirthpodcast@gmail.com. Use the subject line "Share My Story" and I will be sure to get back to you as soon as possible. Want to put a face to a voice? Head over to any of our social media pages linked in the show notes below to see more photos of today's guest. Any resources or topics discussed in today's episodes will also be linked below. Thanks again for being a part of the Bigger Than Birth community, and we will see you next week. Bye!